everyone who's registered will have access to it. And I appreciate your patience, those that are actually here live.
I definitely appreciate your patience because my computer might be frozen. Well, while it's trying to, I'll just briefly introduce myself. So my name is, I am a naturopathic doctor and a mental. I started as, and as I was treating my patients, I realized there was a component that I was unable to help with, and that was the mental health component. And naturopathic doctors, we say that we treat the whole patient, and so I felt like without that mental health component, treating the whole person. To go back to school, um, holistic approach for CADASIL. So my objectives tonight, we're going to talk about mental health. I'm going to provide you a few tools for coping, and we're going to talk to, if I have time, get to the portion component right now that I'm interested in was the mental health. So that is the is. I get back to do more on the naturopathic, that would be awesome. If not, you at least have bones information here for you. So CADASIL mental health. If you look at the research for chronic illness, the number one thing that happens is depression, right? It's hard to deal with illness, especially if the symptoms include pain or unpredictability. And then after that depression, if it's untreated, you get that loss of hope. And there's so many things that feed into that, right? Your illness, the symptoms are, how fast changing the symptoms are, and then what emotions go into that. Grief, guilt, anxiety, fear of the future, so much else, right? We really can't even limit the emotions. It's whatever you happen to feel. Your experience with guilt, or knowing you have, and what's going to happen in the future, or I don't know what's going to happen. So all that can feed into depression and loss. So when we're talking about counseling, there's many theories, right? You can go CBT, you can do DBT, and there's like all these acronyms and all these initials, and it's hard to know which way to go. Fortunately, research has showed that the biggest component of counseling is actually the person if you have a rapport with that person, if you trust that person, even if it's a slow, that's what's more important, that relationship with your counselor. So choosing a counselor and then going from there. Like if you don't like that person, it is okay. You say, you know what? You're just not the counselor for me, and you move to the next one. And maybe you're really fortunate and it's that first person and you hit it the bat and you guys can jump right into counseling. Sometimes it works out. But when you get to counseling, there's kind of this process, all these different theories. There's these stages that kind of, it just might be how the counselor gets you to that process they're using. So it's just recognizing that you need a counselor, right? That's the process part. You're like, okay, I got all these issues, I got all this stress, I got all this going for me. Is it gonna help me? And so that would be the processing part. And then there's a few sessions where you're processing, just going into counseling and all the work and how is it going to look for me in the future. And then normalizing those emotions, letting you know that guilt and fear and confusion, depression, all of that is common and you're not alone, right? You, even if it's not necessarily CADASIL, there's counselors that work with people with chronic illnesses. And so just understand Sometimes you feel like you are the only one and God forbid you were the only person dealing with it. There's in a counselor that can empathize with you and help you deal. And then exploring it. What does this mean? Now that I understand my emotions, now that I can name my emotions, what can I do with it? How am I going to move forward? Do I keep feeling these emotions? Do I reframe my thoughts? All this goes into counseling, and it all helps you where to go in the future and how to get rid of, lessen depression, how to get rid of anxiety, or again, just decrease. And so these are the three main steps that you may see for counseling. So coping and resilience is really what we're talking about. If you can't cope, you can't become. And so the first steps are really basic things. Now, for me, I should say basic about things. Basic makes it sound like it's super easy to implement, and it's not always, unfortunately. Faith is very important. And so most of my clients that come to me, because I advertise as a Christian counselor, does not have to be, right? Because we still respect autonomy. For me, my prayer and Bible reading is very actually backs that up. If you're a spiritual person, denying that part just doesn't make sense. If you're not a spiritual, you can still do meditation and reading, right? Uplifting, something that's going to help you not focus on the symptoms that are bothering you that particular day, or and then journaling, expressive arts, just being creative. And sometimes it doesn't even have to be you doing something creative. If you're not into crafts or painting, you can go hiking and just being in a different environment. Is not for everyone, nor can everyone do it every day, especially or having a migraine, or right, it's not necessarily something you can do. But can you walk and change your view instead of sitting on the couch? I'm sure there's days you can, and there's days you maybe can't. But the point is just keeping the brain active. Is it reading a book? Is it doing a quiz, a fun quiz, like a trivia game, something like that? Gratitude. It's amazing, the research, if you read it, on acts of kindness and how just doing something small, and it doesn't even have to be something that costs money, but smiling to your cashier, right? Sometimes we forget that they've probably dealt with a lot of cranky customers all day long. Come along and just you smiling and asking how their day went takes most of the negative from all those other customers. But the gratitude also helps you. So keeping a gratitude journal, waking up every morning, you know what? Oh, I don't feel great today. The pain is here, the pain is there, all this is going on. But what can I find? My dog laying next to me, the fact that is it just the fact that I have food in my fridge and I can get up and get something to eat? Whatever it might be, right? As it is, as long as there's something you can find to be grateful for. Routines are important. So building some type, even on those days, or even if you're in a hospital, can bring along a favorite blanket or a favorite pillow, drinking your tea the same time of day, whatever you can to maintain part of that routine. I know in the hospital it's hard because they're always waiting. Every 4 hours, we got to take a blood draw. Something to give you some sort of stability, even when life is not very. And then mindfulness, which can sound like there's many keywords for it. Grounding, breath work, being present, those are part of mindfulness. And with the mind, really just saying, okay, I'm not going to worry about the past. I'm not going to worry about the future. I'm going to enjoy what I can in this moment. Even if this moment is not the best moment, like it's not what I would wish it to be, but what can I find in this moment to be thankful for, gratitude, right? Or what can I find to do in this moment that takes my brain, whatever is hurting or whatever happens to be bugging me that particular day? Or what can I do to decrease some of the stress from going to work or from dealing with a family member, right? All of these are just ways where you can calm your body and ground yourself. All of those keywords fit into this. And then staying connected. We forget that we are relational beings, right? Even us introverts. And so when we are having those bad days or bad weeks or bad months, it's really hard to stay connected. Connection part is for emotional health, but really for physical health. Your physiology actually with people, especially if there's some touch involved, and it doesn't have to be sexual touch, right? It can be someone giving you a hug. It can be someone putting a hand on your shoulder. All of those types of touch. Oxytocin, the happy gene or happy hormone. And so staying connected, if it's a time where you just can't get out on a webinar, right? Can you go online? This virtual technology nowadays, that even though it's not, you can get that mental emotional connection. So staying connected and stay with people when we see them. So the research for CADASIL says that you are going depression and apathy and irritability and fatigue. I claim nothing, right? You're going to have one of something, even if it might be fairly inevitable, because we don't know really cannot say what our future is going to be. Maybe in an ideal world, the miracle cure is a day away, year away. We don't know, but what we in this moment we are dealing with something: guilt, shame. It's a great day. Maybe we're dealing with joy. That would be awesome. But the point is, there's all these things going on, and it's cyclical. There's going to be days where we're more depressed and more happy. Our brains work. It's the way life works. It's way. So knowing how to deal with all this as it comes along, part of being able to build that resilience, part of being able to say, I know today sucked, but tomorrow can be better. What can I do to make tomorrow better? Or maybe I can't even look forward to tomorrow. What now to just increase a little bit of hope or a little bit of happiness? Is it tea? Is it petting your dog? It could be, which is why the coping skills end up being kind of a puzzle. So survivor's guilt. This is with clients that have chronic illnesses, especially familial component to it, a family component. I am well, and so how do I deal with that? Well, first of all, that is a normal part of having a chronic illness. So just like all the other emotions, cyclical. You'll have days where you're like, I feel guilty about nothing. And then you have days where your brain just guilty for everything. And that's part of having coping skills and being resilient is no. This is not, and we'll talk more about, this is not my truth for today. So how do I get through this? Or if you're stuck in that cycle, how do I from that cycle? And one of the ways framing, almost every type of counseling, reframing, they may not call it reframing, but it's and reframing it, right? Rethinking it, evaluating. And how can I change that? So if the guilt points to like a repairable behavior, I'll make amends. I'll fix that. But if the guilt is saying it's attacking who I am, that's when we practice. Right? So do I even have something to feel guilty about? On pathway says yes, I do. And I need to apologize for that. Right? Admitting that we are wrong it's a strength. If we are able to say or to recognize in I did not have kind words. Whatever, right? I could have been nicer. I could have been, I didn't need to be angry, whatever it might have been. We can apologize. Or there's the no. You know what? I don't have anything to feel guilty for. So why? And examining that and then giving yourself action. And that's a big thing, is being able to say to yourself, okay, I made this mistake, or it's okay. Right? You can't just be like, oh, it's okay, and then not change anything. Part of being resilient is that you're changing your behavior as you're going. So building resilience, how do we do that? And this is a 3-step process. Books about it, right? This is very minimized because literally it's chapters in textbooks. It's written. There's all kinds of information about being emotionally flexible. So the first step is noticing and naming. Back to, if you think of the slide on counseling, that's what we were talking about also, right? You cannot fix a problem if you don't recognize there is a problem. And for resilience, how do we become resilient if we don't know what we need to overcome? We need to change. So recognizing the stressor. What is the stressor? Is it actual stress? I have a hectic job and it's chaotic stressor, or is my stressor just, I say just as in not just like my symptoms. Is it a person? And I need to work on that relationship. Whatever, right? Recognizing what it is, naming it. Name this, or is it so unfamiliar or that I can't even name it? Or maybe it's so that you can't name it. And that's okay. When I recognized this, what was I feeling? Was I feeling it in my body? Like, are there physical symptoms? Or is it just in my head, or maybe not even just in your head, but it didn't quite from your brain to your body, if that makes sense. This is not making sense. But sometimes think of it like anger, right? Where you feel that in your body, right? People clench their fists. So that's what I mean by that. Emotions we feel in our body, not just anger. And then writing down the first thought that came to you with that stressor. Now, this doesn't necessarily all time, right? Because if you're just recognizing name it, you probably didn't even recognize what your first thought was because you weren't. So sometimes this is a process, is okay, I recognize the stressor, still can't name it, but I can recognize that this attention next time. Then the next time it comes along, oh, okay, I felt this before. This is what I wanted to, is anger, guilt, shame, whatever it might be. Reflecting, how did I feel? Now that I can name this, how did I feel? Was I tense? Like, and that, surprisingly enough, for some surprise where you're just like, I mean, deal, but and we'll talk about apathy. It didn't fully affect me the way I thought it would. And then writing down that first thought. Was it so and so? Or, you know what, I don't even want to deal with it. Whatever the thought might be. Sometimes the thought that goes with it is very surprising. Especially, not to talk about trauma, but talking about trauma. In trauma work, a lot of times people name, I didn't even realize this was the connection, right? So sometimes just being thought gives us this big connection, the stressor, or even clearly, because now that we have that first thought. And then reframing the thought. So first of all, Most of the time, our thoughts, and recurring thoughts are not true, right? They're based and then kind of changed it to fit a lot of times childhood stuff, right? We dealt with it, but as a kid we didn't know how to name it, and then it just became this thing, and here until we deal with it. And when we start thinking, this isn't even true about me, this doesn't even make sense, this is in a way that as a kid I couldn't do anything about that, so why do I feel that way, right? Bigger thoughts as we become adults. Someone will say one thing about us and somehow can turn that into like everybody hates me, right? And part of that is just our brains tend to and then we snowball with that. So reframing the thought, first of all, so what is true about it, and naming what is true. Is this negative? It is time, unfortunately, for most people, their reoccurring thoughts are negative. And is this exaggerated? And if it is exaggerated, what is there, and what do I need to do with that? Have it to that routine, but still remaining flexible. So part of resilience, like I said, is emotional flexibility. Flexibility in your daily routine, in your day. So I have a plan and I have a routine, but when something breaks up that routine, right? I wake up and I am in too much pain routine right now. How can I be more flexible? Well, I wanted to, the way I feel, that's not going to happen. So I can, I think myself a cup of tea, do some stretches, but I can get that cup of tea, lay back down and enjoy a good book or watch some. So being flexible and not, and still have yourself and not blaming yourself, like, why can't I get out of bed again? Some major red flags to look for, whether it's in yourself, is withdrawal. So back to that, we are relational beings, right? If there's sudden isolation, especially if it's preceded by what we call love talk, and that would be thinking about you and here's my most prized possession, right? Or all of a sudden a person who used to text you a couple of times, you no longer can even get a hold of them. Talk where they called and left you a voicemail and were like, this and that, great, love that you appreciate me. Wait a minute, does this sound like someone is saying goodbye? That's accompanied with isolation. Someone has withdrawn, has isolated, sometimes it's weak, right? We're overwhelmed with symptoms, and so we just need to recover. But the isolation can also be. The next one would be the worthlessness. Every life is valuable, right? I hope nobody argues that. It is valuable, but these chronic symptoms, it's really difficult to find that valuable. And it can be really overwhelming, especially nonstop, and you can't find relief. So the going to grow if we don't have the coping skills. And so being able to recognize that either myself, I'm spiraling towards this worthlessness, or my loved one is worthlessness. How do we interrupt this cycle? How do we make this doesn't get even worse and start going in the opposite direction? So that leads to the next one, hopelessness, right? So worthlessness, there's a lot of people that come for counseling they're dealing with. I really feel in my everyday life that I haven't been able to find self-value, self-esteem. hasn't been dealt with and hasn't been dealt with. And then they come to us and it's the stage. And that's what worries me the most is the clients that come and they feeling and apathy. So I'm not going to try anything. I'm not interested in trying. And most of those people are only at counseling because someone else made them go their loved one happy. So if someone is talking or saying things like, well, I don't even want to tomorrow, or I can't deal with tomorrow, that wording, like sometimes we just say that because they're simple. It feels good to be like, you know what? But it can, that person literally has given up and they don't plan on being here tomorrow. To recognize that we need to, so that we don't wake up the next morning and go, oh, this is them, and then have to deal with a different type of guilt, because we're going to talk more about that. Recognize when withdrawal, when worthlessness, and when hopelessness flags, and are not just someone kind of in the middle of a bad day. Questions for medicine, you guys?
I do have one question that has come in if you want to address it. It's
sure. Let me get back to you guys.
Okay, and let me also post the place where they can find your additional work. So that should be visible now. For additional background and more on Dr. Sciarini's work, you can go to the websites that were just posted there. But here is a quick question for you, and it's a very interesting one.
Okay.
Okay, are bioidenticals used to help women who are perimenopausal, menopausal, or are they contraindicated for women with CADASIL? So the contraindications probably we'd want to defer to a neurologist or a CADASIL specialist. But as far as if you could talk a little bit about maybe how it could impact and anything about bioidenticals in general.
I'm going to be honest, it's not my I don't even practice.
Oh, okay.
I'm not also I'm going to say I do not know. Mind researching if the person wants to reach out to me.
I absolutely respect that answer and thank you for it. Sometimes the best response is just knowing when to defer to somebody with greater. But I admit I'm so interested in that question as well. It was a great question. Yeah. So thank you for the sender, and then I can turn it back to you if you want to continue from here.
Okay. So I know that when I'm nervous, I always talk faster. To be at this point already, but that's okay. I go back to sharing. Okay, now how did I get to PowerPoint? Okay, so if you were not, quick overview. A lot of people think that we are not evidence-based, and I will agree that there are many naturopathic, if you can't see me doing quotes, naturopathic doctors that are not evidence-based. And because it is just, naturopathic medicine is just now re-emerging as a main profession, right? And so it's getting re-licensed in states and re-registered and all goes along with licensing. So I'm currently in the state of Texas, and they do not register regular naturopathic doctors in Texas. So my license is, and so part of the problem is that there's not people that are calling themselves naturopathic doctors have, and not all online degrees are bad, but a real organization, right? They're calling themselves something unregulated, and that can cause confusion in the people that actually, um, and then just knowing that there's a master herbalist, not that they don't know anything about naturopathic medicine, but that's a um, niche, right? So naturopathic doctors actually go to med school. The difference in the med school is that once we get through the first 2 years, doing all the anatomy, same thing that medical doctors do, is right. So we learn the same diagnosis. The first 2 years is all the same sort of classes, and then when we go to treat, that's where we start, because we're now treating. We're emphasizing prevention first of all, right? How do we get you to not place? And then if you do need us, we're going to focus on evidence-based holistic treatments. Now, again, a caveat, these are years of people using them and randomly controlled, highly researched things, right? Because that it's becoming more and more prevalent. But just know that someone's been using it for 50 years and it was passed on, that sort of thing. So, but we are trying to get all that science is now with the science. But some of the things we're going to talk about are know that now. We're basing it on the mechanism of action. And so I'll talk about that more. But so, being an actual naturopathic doctor who went to medical school, gone through the exams, and has a like, this is the naturopathic doctor that I'm talking about, and that is what I am. It was hard work. And I want you to know it did not just take a couple of seminars. So that's my point, is that if you understand where naturopathic medicine has, that's why some of us get a really bad rap, because they're not actually trained naturopathic doctor. And then as I already mentioned, has a counseling degree, master's in clinical mental health counseling, and a master's in human military resilience counseling. I don't even know why my brain will not connect with it. And then they're guided by the naturopathic order. I don't think I made a slide on that. And then the naturopathic determinants of health. And so a big principle is treating the and doctor as teacher. So we do a lot. So the naturopathic determinant. Give me 1 second, excuse me. Naturopathic determinant. So genetics, that's the inborn factors. Choices. Do you have a good diet? Are you moving around? Work into epigenetics and work into in general, right? Because if we're not giving it the proper nutrients, it's not going to work at its optimum. Actually, it's going to start breaking down also because it's been years and years since it's little. Social and cultural. So everything we deal with every day, right, and feeds into our mental health. So that comes from, do we have money? Have education? How much education do we have? So that's kind of the social aspect. And then environment. I grew up in Wisconsin, and was a farm that was sprayed quite often. We always knew you could smell it, you could barely breathe. I mean, literally, our apartment building was 8 feet from the edge of the cornfield. My sister and I both grew up with lots of problems, possibly from that. The point is your environment, where you spend your day. Are you building? and you have this building that you need to get paid, but you know it's not a healthy building. Do you not have money in your house you're in, but you know it's unhealthy? Or are you well off and you have gotten to build it yourself or whatever it might be? So our environment feeds into that. Are we in a rural area? What state are we living in? Right? Some states, others. Some states have cleaner water than others. So we may be in this health country, but it doesn't necessarily mean our environment is perfect. Our mental emotional state, especially if we're talking about homeopathy, the mental emotional comes in. And then of course the spiritual part. So even if you're not, I think most people would agree that there's like a spiritual. Okay, so the first, genetics and the inborn factors. So when we're talking about epigenetics, if you're not familiar, the expressions of genes. So people call a tag on your DNA that is, think of it as a price tag, right? If it's real and it's turned up, right? If it's really cheap and it's turned down. So it doesn't change the gene itself, how the gene is expressed. All of a sudden my stomach is like not happy with me. So the epigenetic, literally being able to modulate some of your genes. And I think the one is probably right, where we know without a doubt that there's this class syndrome person, however you want to look, of symptoms that are going to put you diabetes, and a lot of that is diets and lack of exercise. Perfect example of epigenetics. When you turn down those genes, right? Body, good nutrition, where you're moving around. And when I'm talking about moving and doing like all these major exercises, just getting up and cleaning around, taking the dog out. It does not have to be exercise, just moving your body in general. The epigenetics is literally being able to modulate those genes. I'm assuming most of you know CADASIL is a Notch3 gene, right? So we're talking about a gene. I don't know any research out there genetics of Notch3, but a gene in general is going to make sense that there's a component to it. And most likely it's going to be diet, right? All those things that make the body work better to begin with. So naturopathic medicine and CADASIL, these are the researched, and I don't think all of them in depth. In fact, I'm pretty sure I don't. When we're talking about CADASIL, we're talking about the blood vessel walls, is one way to look at it. We're talking about myelin sheaths in the brain. That's the leukoencephalography. Let me talk leuko. I'm not even going to try to say big words right now. Brain is shutting down on me already. Anyway, talking about these major things that we maybe can have an influence on, and that's the part where I was saying this is going on theory right now, because a lot of the research for CADASIL, none of the research for CADASIL is in this area. So that we'll talk about in a moment is the mechanism of action. These botanical medicines that, and so I'm going to be talking about supporting vascular. Going to cure anything. I don't even know if it's going to work technically, but if we're talking about supporting if it supports vascular health, there's no reason why it wouldn't support the vasculature like CADASIL. It just probably isn't going to have the good in cardiovascular health, right? Because it's a different mechanism. Same for inflammation, but inflammation, I can almost 99%, you can decrease that inflammation, you're going to affect something in a positive way, because inflammation is, unless you're talking about a wound healing that you type of inflammation for, right? So if we're talking about decreasing inflammation, it may not, again, have a huge impact like it would in other areas, but it's still going to help. And then supporting to slow, hopefully, slow the vas. And then again, the influence on the epigenetics. So about supporting vascular. One way to do that is medium chain triglycerides, and there is a little bit of research on that. Advantage of that, and so the literature on this is in epilepsy, but it might be research, sorry. But the medium chain triglycerides, telling you my brain for the moment, damage. So when you take medium triglycerides, your brain is more likely to have the blood flow, less ischemic damage, but there's also a component, the tissue. And so that was really cool to read about. And again, so this is all theoretical based on the mechanism of action, other diseases, right? So, but it's also not going to hurt anything. And then the next one would be vinca minor. And also with these, you're not going to start anything without that bioidentical hormone. You need to talk to your doctor who's giving you your prescription, interactions, all that kind of stuff. That needs to be double checked. And then you, for instance, flour. And so if you're allergic to something like that, you would need to keep that in mind before you would start a supplement. So all this is just for you to see that there may be ways beyond the science that you've already read about and then helping you with, that we may be and decrease some of the progression. But again, just want to stress this 100% theoretical based on the. So vinca minor may slow the vascular dementia because it increases blood flow to the brain, is a relaxation. So not only does it support the build blood vessel walls, but it helps the vasal relaxation, or the vasculature to work a little bit better. So this is not fully accurate, but it's a good way to think of it. If you think of your blood vessels as, right, so you can tighten a muscle, you can relax a muscle. Your blood vessels do that same sort of thing. And so of the vascular dementia to the brain is the fact that they're not as kind of a stiff, scarred, fibrosis. There's lots of words for it. And so if you can slow that progress down, you should be able to dementia, at least slow it down a little bit. And then sinensis and ligusticum striatum, all these big words today. Use vascular inflammation, and that goes back to what I said about inflammation. Decrease inflammation, whether it's specifically vascular, systemic, whatever type of inflammation, you're going to make a difference, because inflammation, know that there's no research that says the opposite. Inflammation is how much damage, and is the damage reversible? If it's a minor wound, right, you may have a bruise, which is inflammation, but that inflammation goes away, leave any long-term effects. But if you have a cut or wound, right, those are bigger. That's more inflammation. That's a bigger, that's going to leave damage. And so it's the same inflammation when you're thinking of the blood vessels are inflamed. the more damage there's going to be, and the faster that you're going to see increased symptoms and increased changes. If there's being able to decrease the inflammation would make sense. And for, excuse me, my brain has left me. Between the Angelica and the Ligusticum had better research for the specifically for vascular inflammation. So Angelica is amazing, but the Ligusticum had really great research provided for you on vascular inflammation. And then again, so I apologize. I just realized I references on here, so I will add that. So obviously, anti-inflammatory diet, when done properly, it's a great basic balanced diet. And evidence for epigenetics. Again, not specifically in CADASIL, but just for epigenetics in general. When you have a balanced diet, this helps inflammation. Prioritizing sleep. If you're not familiar, when you have poor sleep or disrupted sleep or not, your inflammatory markers go up. The inflammation in your body literally is raised when you are not sleeping well. So just being able to sleep well is important for research on sleep and mental health. Also amazing how much that correlates with one another. And then just I put the standard, not familiar with standard inflammation supplements. It is turmeric and omega fatty acids. Now, there is theoretical research that says that omega fatty acids in high dose can be blood thinner. In reality, there's probably always that one person that it could. And then, of course, or anticoagulants, you're going to want to keep that in mind. But turmeric, omega fatty acids they're both fairly inexpensive, especially the turmeric. Omega fatty acids is a little bit more expensive, but prices because more and more people are using them. But both of those for anti-inflammatory, so for decreasing inflammation. Research for both of those. Again, not specifically. So, in conclusion, support, right? Long term, we need it for coping, dealing with something that is long term. It just makes sense to have that counselor, and you don't have to necessarily go when counseling starts. That's when it's weekly. Those coping skills, when you have the resilience, it can be a bi-weekly, be just what we call maintenance, where you just every once in a while make an appointment. It would be what you would discuss with your counselor, but knowing that started, I can get those skills, and the sooner the better. Is chronic illness. Naturopathic medicine is a complement. We are not saying it replaces anything. It is a complement. What are these things that make sense health-wise that may help with the CADASIL? Keeping in mind that this information is to empower you and have the skills, have the knowledge, be your, that's what's important. And knowing, right, not really for me, but I like this, and this may go through on this, and that's okay, right? Some people, back to the coping skills, some people, and they don't for others. And just knowing what and what is helping you, and finding those tools so that you're just you're kind of a lost. When we're kids, we don't have the skills. We may not have the even a good what to do, and this will empower you. Any of the to have that advocate for yourself and have that knowledge for yourself. Yeah, this makes sense, or no, this doesn't make sense for me. All the references are here, and I will add the ones that I missed. They're probably in the list. I probably just didn't put them on, but they're all there for you. Let me get back to where I can see.
Thank you, thank you, thank you. We do have some more questions if you have
Okay.
time. And that was so fascinating and much appreciation. I have just three quick questions. We don't have a lot of time. I try to end these on time for folks, but if you could just briefly, and if you're not sure and need to defer again, please let us know. So one of them talked about one of the a common symptom in, or not common, but some people with CADASIL suffer from adult onset seizures, and the writer is wondering if there are any naturopathic treatments for clonic seizures caused by genetic diagnoses.
Okay. So that would go back to there's no specific information for CADASIL or for seizures, but there is information that talks about blood flow to the area, reducing inflammation to the area, increasing the production of the myelin sheath, right? The protection of those nerves. Supplements that have research that shows that it helps with all of those. So again, in theory, it should work the same in CADASIL, but we would also have to look at all you're taking, what else is going on, right? So that we know, is this safe for this person to take with everything else? I forget that supplements are medicines, right? Just because we can get them over the counter doesn't mean that we should just start taking them. Not in high dose or with other prescriptions or with other products, because that's when you find like, oh, take these two together and now I have, vomiting or whatever it might be, or even just diarrhea. Unpleasant, not going to kill you, but still just keeping in mind that supplement and should still be used properly.
That is so critical. Thank you so much for emphasizing that. In fact, the next question is somewhat safety related as well. So I do think this is really important to highlight. You had mentioned turmeric, and the
Yes.
writer states, given turmeric is known to be a natural blood thinner, is this a risk for people with CADASIL? So I guess first confirming turmeric as far as its blood thinning nature. Could you speak to that?
It has to be a fairly high dose. And most people do not take the dose that would end up thinning blood. To what I mentioned with the omega fatty acids, both of those are fairly theoretical. Them in a couple of people, right? So the it's there that it can be, and it would also go back to like, if I'm taking an anticoagulant, do I also need to add this in, and is it safe to add it in? So that would depend again on the dose, and I'll just mention it's going to depend on where you're getting to. There's been TikToks and articles about people getting supplements on Amazon that are not the actual supplement that it shows on the bottle. So they're not getting what they thought they were buying. And so just making sure you're buying from a known, trusted source too, so that you actually trying to take turmeric, you want to be taking turmeric, right? And then not only if you're taking turmeric, but is it the dose on the bottle that I think I'm taking? Is that what I'm actually? So keeping that all in mind. But yes, there is a the science is there that it can be an anticoagulant, but dose, and most people do not take that high of a dose.
Yeah, and I think that's great. I think that's also really important to mention that, you can also share with your physician any interest in taking any of these supplements. And I think we've hopefully gotten past the time where it's viewed as mutually exclusive. We should be able
Right.
to talk both with your neurologist and your naturopath and really share what's going on between both clinical settings. So, okay, two more quick questions if we have time.
Okay.
One is, what is an example of a medium chain triglyceride?
Oh, yes, that's an excellent question. I should have mentioned it. Easiest one to find, and the best example is coconut oil.
Super. Thank you. Thank you. And then if you could end with this one, I would be very happy to just have you touch upon, you mentioned the importance of an anti-inflammatory diet. I think anything that decreases inflammation is super critical. If you could just talk to us, maybe like, what does an anti-inflammation diet look like, or how would you describe that?
Yeah. So number one of an anti-inflammatory is white sugar, white flour, all of that is minimal part of the diet. So not refined foods. You want to eat whole foods, right? If you're going to eat an apple, flavored apple or whatever. There was something the other day, cookies at the store to buy cookies, and she called me and she's like, "You're not going to believe this, but there are." How was it? It was chocolate flavored chocolate chip. It wasn't chocolate. It was chocolate flavored chocolate chip cookies, and I was like, "What? You can even just put chocolate chips in there?" In mind, right? The natural part. You're eating the whole food as much as possible. If you can do organic, great. It is a problem. So if you can't do organic, maybe there's the dirty dozen, more than a dozen now, right? But there's this certain vegetables and fruits that they recommend getting organic when you can, just because of the pesticide levels. But really, I think just as long as you're trying to so eliminating the sugars, eliminating sodas, eliminating the fake sugars too, right? Whatever else they put in diet drinks and stuff now. Anti-inflammatory is going to be full fat foods, which surprises people. You don't want low fat yogurt. You don't want low fat cottage cheese. You want the full fat. And that goes back to those omega fatty acids, right? Important for brain health. And we tend to forget that because we think of fat making us fat when most of the time it's actually the sugar that's making us fat. And then the meats that you're eating are going to be lean meats. Does not exclude bacon. And then just like everything else, those higher fat foods like bacon would just be not on an everyday basis. Same for beef and chicken, right? Vegetables, fruit, the main portions of your vegetables should fill half of it, and then you're going to have a small portion of meat and maybe a small portion of a whole grain. The whole grain does not necessarily have to be there. You want the fruits and vegetables for sure. Meat.
I learned very many new things. I'm very thankful to you. We will stay in touch so that you can be included in the CADASIL Doctors Directory as an additional resource for people that may want to add naturopathy to their care regimen. I did post where your background and additional information websites are available to folks. And we also have 2 really great webinars lined up in October and November already with some of our lead CADASIL investigators from our research study sites. So I hope those that are joining us will tune in again next month. And Dr. Sciarini, thank you so much. And yeah, we really welcome your participation tonight. Thank you.
Thanks, and I appreciate what you guys do for CADASIL, because without you guys, the community strong as it is.
Have a wonderful evening.